Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Certificate Programs. Certificate in Geriatric Care Assistance, CGCA. BHT-006 Foundation for Geriatric Care Assistance, CGCA. Block-1 Basics Concepts for Geriatric Care Assistance, GCA. Unit 1 Qualities, Values and Ethics in Geriatrics Care Assistance. 1.0 Objectives. After completion of this unit you will be able to explain the scope of Geriatrics Care Assistant, GCA, and list the personal qualities required for Geriatrics Care Assistant, GCA. Describe the role and responsibilities of a Geriatrics Care Assistant, GCA. Explain the patient rights. Describe code of conduct, and describe the values and ethics. 1.1 Introduction. All the health professionals have defined responsibilities in the hospital and even you as GCA have defined responsibilities. All of them work according to their job responsibilities, post, specialized knowledge and skills. In this unit, you will learn about your job responsibilities, importance of ethics and values, and patients' rights. 1.2 Geriatric Care Assistant, GCA. Program. The Geriatric Care Assistant, GCA, program is a short-duration skill-based training program with an objective to develop a pool of trained workforce which can be employed to provide support to old age patients and assist other healthcare providers majorly in home, old age home, including assisted living facilities, settings, rehabilitation facilities or otherwise in hospitals as well. This program focuses on the acquisition of skills necessary to provide support by undertaking non-clinical tasks or the activities that have been prescribed for the patient by the healthcare team members. The program is meant for achieving the following competencies in the students, so that they are able to describe the overview of the healthcare and hospital systems, role in responsibilities, professional behavior, communication and ethics of a geriatric care assistant, demonstrate skills in basic geriatrics care such as assessment, patient positions, movements, preparation of facilities, feeding, hygiene, grooming, dressing, bathing and elimination needs of the geriatrics patients, oral care, hair care, eye and ear care, skin, nail and foot care of geriatrics patients. Demonstrate skills in management of positions and pressure points, disabilities and well-being of geriatric patient, mental health issues in geriatrics patients and basic life support, BLS, measures and first aid in the event of emergencies. 1.3 Scope of work for Geriatrics Care Assistant, GCA. Geriatrics Care Assistant, GCA, is expected to demonstrate practical skill and perform routine and repetitive limited set of activities, such as providing daily care, ensuring patient comfort and safety and attending to patients' need, cleaning equipment, documentation, transporting patient samples, among others. Geriatrics Care Assistant, GCA, thereby can be categorized under Level 3 given the Geriatrics Care Assistant, GCA, works under close supervision and is responsible for own work within defined limits. The Geriatrics Care Assistant, GCA, independently cannot make decisions to undertake tasks within the clinical settings unless directed so from a nurse, doctor or other healthcare provider from the team. However, as some activities are under close supervision such as patient handling, some responsibilities are rendered upon the Geriatrics Care Assistant, GCA, when she is able to find the way through the healthcare setup, such as that in case of patient sample transportation. The expected outcomes after completing the Geriatrics Care Assistant, GCA program is to carry out limited set of tasks that are routine and predictable in nature. The candidate will have to follow a specific defined protocol and sequence of activities to ensure that the patient environment is safe and conducive for other healthcare members to act upon as per the patient's need. 1.4 Personal qualities required for Geriatrics Care Assistant, GCA. The job of Geriatrics Care Assistant, GCA, requires the individual to work in collaboration with doctors and nurses and other healthcare providers and deliver the healthcare services as suggested by them. The individual should be result-oriented, The individual should also be able to demonstrate basic patient care skills, communication skills, and ethical behavior. In this section, we will discuss about the personal qualities required for Geriatrics Care Assistant, GCA, as a healthy individual and as a team member. 1.4.1 As healthy individual. There are a lot of qualities to a healthy person. One of the quality of a healthy person is that they are always on the go and hard at work. They aren't lazy and full of energy. Healthy person is physically fit and active in day-to-day routines, tireless working. Healthy person works with due attention, good memory and good mental ability. He has balanced emotional status, without medication etc. Following are the qualities which make the person to feel as healthy individual. 1. Self-development. Self-development means that person always try to improve what he, she has already done. Person with quality of self-development do not give importance to past achievements and constantly sharpen their skills to become more productive. 2. Positive attitude. A person with positive attitude believe in themselves and like their work. They are nice to people. Other people enjoy their company. Other people will be happy to be with them. If things are difficult, they are able to face them, come out stronger. They don't leave everything to luck and fate, as they do not lose hope. 3. Self-motivation. The term motivation has been derived from the word motive. Motive may be defined as an inner state of our mind that activates and directs our behavior. It makes us move to act. It is always internal to us and is externalized via our behavior. Motivation is one's willingness to exert efforts towards the accomplishment of his, her goal. A student pays attention in the class and also spends extra time studying at home because he or she wants a better grade in the class test. If you wish to improve yourself and reach your goal, then you have to act positively. Sometimes things are difficult at home or at work, but we learn to face them. Gain from your difficulties. Don't let them pull you down. Don't let fear change you. Once the fear is gone, you will be back to your old ways. The change in you must come from within you. No one can improve you. You have to improve yourself. 4. Personal hygiene. As discussed earlier, that healthy individuals maintain hygiene, in which is visible in their behavior and looks also. Some of the tips for personal hygiene which you must be following also always, if not, please try to follow. Brush your teeth every day. Clean your hands and feet. Bathe daily. Cut your nails once a week. Wear clean clothes. Don't chew gudka, or smoke or drink. Keep your room and toilet clean. As a geriatrics care assistant, GCA, on the job you need to provide patients' daily care, patients' comfort, patients' safety and patients' health needs. While working, you should also look presentable, neat and clean. 1.4.2 As team member. In a football team, each player is important, but they can win only if they play together as a team. A bee works very hard, but a single bee alone cannot make honey. The bees work together and make honey. Geriatrics Care Assistant, GCA, should also work in team under supervision of doctors and nurses. You are a team if you are united like the football players. To work in team, you need to have some of the qualities as follows. 1. Interpersonal communication skills. Effectively communicating with coworkers is an integral part of patient care management. A geriatrics care assistant, GCA, needs to consider the following while communicating with coworkers. Ensure that communication is precise and brief. Give facts and not opinions, unless specifically requested for, and have a logical structure to the communication. Use an appropriate combination of verbal and non-verbal communication. When you listen, pay attention. If others find fault in you, do not get angry. Think before you find faults in others. If you follow these rules, people will like you. 2. Work etiquette. Geriatrics care assistant, GCA, needs to learn work etiquette, and before learning you need to love and respect your work. Don't feel your work is boring, rather you should find new ways to do your work efficiently. You need to rest when you are working as per policy of organization you are working in. If you enjoy working and feel confident that you're doing right, Your work will help you to grow and you will be successful. Follow the 5 rules of work ethics. Speak clearly and slowly in a gentle tone. Use the correct combination of verbal and non-verbal communication. Use language familiar to the listener. Give facts and avoid opinions unless asked for. Structure brief and logical messages. 3. Time management. You can relax and work if you manage your time. For learning time management, you need to ask following questions to yourself. Are you always rushing with reference to job-related work? Do you try to do everything at the same time? If answer is yes, then you need to learn how to divide your tasks as per the priority and importance. What must be done immediately? Do it first and prepare yourself. What can wait? Let it wait for some time. Do them in between the important jobs. Finish your tasks on time. You will have more time for yourself. 4. Discipline. Discipline is the regulation and modulation of human activities to produce a controlled performance. The real purpose of discipline is quite simple. It is to encourage employees to conform to established standards of job performance and to behave sensibly and safely at work. Discipline is essential to all organized group action. Discipline should be viewed as a condition within an organization, whereby employees know what is expected of them in terms of pay, organization's rules, standards and policies. As Geriatrics Care Assistant, GCA, you also need to be disciplined while working. 5. Honesty. You need to answer the question that, does honesty win in the end? Yes, it does. It is well evident that if you are dishonest, you may win at first, but it won't last long. Honesty is forever. You won't lose. Speak the truth as. For hiding one lie, you need to speak many lies. No one trusts a dishonest person. 6. Anger management. Do you know anger is like a dragon? If you do not control anger, it will swallow you. Following are the tips for control of anger and stress. Try your best to remain calm. Count 1 to 10 before you speak if you are angry and stressed. Say a prayer if you are upset. Forgive yourself and others. Forget the past if it made you upset or angry. Admit your mistakes politely. Do not let your anger grow within you. 1.5 Job Responsibility. Geriatrics Care Assistant, GCA. The key job functions of GCA are as follows. To provide geriatric care such as preparation of facilities and environmental modification, patient safety procedures, patient assessment, patient positions, and transferring the patient from one place to another as and when required. To assist in meeting the hygienic needs of geriatric patients such as general hygiene, principles of dressing and undressing, bathing, guidelines and after bath care. To provide oral care, care of hair, eye, ear, skin, nail and foot in geriatric patients. To assist under supervision in various procedures such as application of heat and cold, Riley's tube feeding, cleaning and replacing urinary bag, enema, suppository administration, preparing patient for operation, theater, collecting urine and stool samples, geriatric patient-related investigations, transport of samples and medication.
To provide advanced care for geriatric patients such as management of positions and pressure points, disabilities, blind, deaf, locomotor etc. and mental health issues under supervision. To practice various infection control practices, safe universal precautions, and safe biomedical waste management, BMW. To assist the elderly persons, their family members for guiding them for environmental modification, patient safety and use of assistive devices. For a geriatric patient. 1.6 Rights of the patient. Patients have the right to competent care, protection from reasonable risks, and advocacy from their healthcare professionals. Following are the rights of patients in any healthcare setting. Right to be free from harm and ill treatment. Right to information, informed consent during care. Right to privacy and confidentiality. Right to be treated with dignity and respect. Right to equality, freedom from discrimination, and equitable care. Right to healthcare and to the highest attainable level of health. Handling complaints, grievances of patients. In hospital, patient and their relatives are the key personnel with whom Geriatrics Care Assistant, GCA, may be communicating frequently. In case of hospitalized patients, they use their call lights or send the relatives to call the health personnel. The top 4 reasons patients or relatives may call: having pain or other discomfort to patient, request for daily living needs, such as bathroom assistance, Change the bed sheet. Inform about IV drip going to finish. An effective way to decrease call frequency is to remove the reason for call in the first place. Hourly rounds to ascertain and meet patients' needs are an evidence-based strategy that reduces the complaints from the patient. Assess the patient's pain level. If the patient is experiencing pain, you should contacted immediately to nursing personnel. If patient is asking for daily living needs, then offer toileting assistance. In case of discomfort, assess the patient's position and position comfort and ask if the patient is comfortable or needs to be repositioned. In case of private ward, the patient call may be reduced by following ways. Make sure the call bell is within the patient's reach. Put the telephone within the patient's reach. Put the TV remote control and bed movement keys within the patient's reach. Put the bedside table next to the bed. Put the tissue box and drinking water within the patient's reach. Put the garbage box next to the bed. Prior to leaving the room, ask, is there anything you can do for patient? Tell the patient that a member of the nursing staff will be back in the room in an hour to round again. 1.7 Code of Conduct, Do's and Don'ts. Conduct is the mode or standard of personal behavior based on moral principles. The way that a person behaves in a particular place or situation. Code of Conduct provides employees with guidance for handling difficult ethical situations related to the job. Code of Conduct Violations. An act that violates the rules written in the Code of Conduct. Conduct cases are those where an employee fails to comply with work rules, policies and procedures such as arriving for work on time, teaming with co-workers, respect, being honest, maintaining attendance record, using company time, supplies and properties in a responsible manner. Fundamentals to a code of conduct. Credibility, monitoring, enforcement, transparency, norms of conduct, honesty and integrity, proper decorum and work ethics, value and ethical standards, job performance, competence, productivity, efficiency and effectiveness, diligence, dedication toward work and responsibilities, administrative conduct and behavior, punctuality and attendance, leave balances, uniform and ID cards, health safety and security. The code aims to make sure that patients are treated with dignity, respect and compassion at all times, and makes clear that Geriatrics Care Assistant, GCA, have a responsibility to ensure that their conduct does not fall below these standards. The code should give the public, and people who use health and social care services confidence that these support workers will provide safe and compassionate care of a high standard. Purpose of the Code of Conduct. For promoting best performance. To ensure that Geriatrics Care Assistant, GCA, are providing high quality, compassionate healthcare and support. To describe the expected behavior and attitude of health worker to the public and people who use healthcare services. Nothing that you do should harm the safety and well-being of people who use health and care services in the organization you are working in. Code of Conduct for a Geriatric Care Assistant. As per the Code of Conduct, as a Geriatric Care Assistant you must be accountable by making sure you are answerable for your actions or missions. Be able to promote and uphold the privacy, dignity, rights, health and well-being of people who use health and care services at all times. Be able to work in supervision of doctors and nurses to ensure the delivery of high quality, safe and compassionate healthcare, care and support. Be able to communicate in an open and effective manner to promote the health, safety and well-being of patients. Be able to respect a person's right to confidentiality. To do your best to improve the quality of healthcare, care and support. Through continuing self-development. 1.8 Values and Ethics. Now we will talk about values and ethics. Values are concepts on the basis by which an individual or community selects the criterion of right or wrong. The important principles that should be considered in Geriatrics Care Assistant, GCA, are respecting the patient, client and preserving human dignity, humanity, kindness and sympathy, devotion to assigned task, accountability, responsibility and sense of right and wrong, commitment to honesty and loyalty, maintaining patients' privacy, and commitment to confidentiality and trust, promote the awareness of rules and ethical guidelines, and respecting them, mutual respect and appropriate communication with other healthcare providers, respecting autonomy of the patient, client. The Geriatrics Care Assistant, GCA, should introduce him, herself with name, title and her professional role to the client, patient. Consider the client, patient's demands regardless of their age, sex, race, economic status, lifestyle, culture, religion, political beliefs and physical Abilities. Perform the care in a way that with attracting the client-patient trust. Their needs and concerns could be understood. Before performing any interventions, obtain the patient or his/her legal guardian's consent. In order to empower the client-patient, educate him/her and their families. Consider all the information given or obtained during the care process as the professional secrets, and do not reveal them without client-patient's permission except in legally the medical information of client-patient only for health-related purposes, treatment, research, and in patient's interest. Using the medical information of the client-patient in research or education should be with their permission. Respect the patient privacy when assisting in any nursing intervention. Report any objection or problem of patient to the ward supervisor. Avoid any action, even in patient's request, that requires ethical, legal or religious violation. Assist the patients who spend the last days of their life for accepting the reality and to appropriately planning of their demands, including performing the religious practices. 1.9 Summary. In this unit you have learnt about the scope of work of Geriatrics Care Assistant, GCA, which will help you to identify your role and limits. Further, this unit will help you to identify personal qualities required for geriatrics care assistant, GCA, and skills required for assistance. While working you need to keep in mind the rights of patients and code of conduct in healthcare setting which has been discussed in the unit. Further, you have read the guidelines to be followed for values and ethics. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.